and welcome to another Health Yes podcast. Here at Cameron County Public Health, where we talk about all things public health and more. Today we'll be going over some recent developments on the topic of fungal meningitis with our guest, Dr. Jose Campo Maldonado, as well as some of the details regarding the treatment process as well. Thank you for joining us.
Thank you for having us here to talk about this important topic. My name is Jose Campo Maldonado. I am an internal medicine and infectious disease physician. I work for UTRGV School of Medicine at Valley Baptist Medical Center. I'm the Director of Infection Surveillance for UTRGV School of Medicine and Director of Antibiotic Stewardship at Valley Baptist Medical Center.
My name is Ameera. I'm an epidemiologist here at Cameron County Public Health. I primarily work on healthcare-associated infections. I'm currently one of the investigators with the fungal meningitis outbreak, and something that we've definitely been keeping a close eye on and prioritizing over the last couple of weeks in particular.
Hello, everybody. I'm Raquel Castillo. I'm the lead epidemiologist for Cameron County Public Health.
And I'm your host, Javier Chavarria, with Cameron County Public Health as well. Welcome to the show. Before we get into the details, we need to ask a very important question. For those that may not be familiar, Dr. Maldonado, if you could explain to us, what is fungal meningitis? Where does it come from, and how does it affect our bodies?
Meningitis may or may not be a familiar word for some of you, and it just means that around our brain and all central nervous system, I mean, you can think about all the cables that connect to the brain. There is a membrane, right? And that's kind of like a covering for the brain. And when that gets inflamed for any cause, including infections, then we call it meningitis. In this case, we are talking about something a lot more specific, which is fungal meningitis. So you're familiar with the concept of fungi or fungal organisms. You have heard about that, but they should not or shouldn't be around your brain, right? So in this case, we have a situation where, unfortunately, a lot of people were exposed to these organisms, we think, and are causing severe illness, causing this inflammation of those membranes that surround your brain.
Can you tell us a little bit about how people typically get fungal meningitis?
First of all, let's all starting by understanding that meningitis is more commonly caused by other organisms like virus and other bacteria, right? And then there are many ways that you can get it. You can just get any type of viral infection, and sometimes this can cause meningitis, but there are many other bacteria that can get there, like pneumococcus, things that are living in your respiratory tract and find a way to the brain or around the brain. In this case, is different from what we are used to. And by that I mean there is also something that you need to be familiar with, which is infections acquired through processes that have to do with delivery of healthcare, right? It's what we call nosocomial infections, or if you get an injection and then you get an infection in the site of the injection, that could be a complication of that. So what we know about this is this likely was triggered by a procedure that is called epidural anesthesia. Maybe there was contamination of the fluid or the processes to protect you from infection when those procedures are done were not efficient or effective. And these individuals who were exposed in Mexico to this procedure probably had that organism inoculated or put in there next to your that fluid and those membranes that I was talking about earlier, and it started to, of course, replicate and cause damage, including those membranes, and also causing inflammation and also causing damage to other structures in that area, like, for example, your arteries or your blood vessels.
That definitely provides a lot of context. We know that when this outbreak first started, meningitis here in Texas isn't a reportable condition, so it wasn't, super alarming to get a case of meningitis. But then, as soon as a couple more popped up pretty quickly, we knew, something was definitely going on. It raised our suspicions pretty quickly.
Now, as a member of the public, like, what are some of the things that we need to watch out for? I guess, like, some people that don't really are knowledgeable of meningitis. what are some things that we should like look out for, or signs and etc.?
That's a very good question. Thank you for asking that. I think we need to make an important differentiation, right? All of us are familiar with what happened with COVID-19, right? In those cases, we were trying to understand what are those symptoms, right, that people present, and how can we recognize them, right? In this case, it's a little different. Those symptoms are also important, and we're going to talk about that. But one element that I think is key for everybody to understand is the exposure, right? So we are talking of all these cases of individuals since the beginning of this year to May 13 travel to get a surgery in Matamoros, right? And so far we are aware of 2 clinics, right? They have these procedures, and including the procedure that I mentioned earlier, where someone accesses your central nervous system, that fluid around your nerves, that also connects to the brain, and to try to put a medication to relieve probably pain, and at the same time, likely non-intentional, right? The fungus got there, right? So what we need to identify is individuals who have those procedures during that time frame, and I know the health department has been doing a great job reaching out and asking people, trying to help them understand. And the importance of understanding this, I think, is recognizing that this is a lethal disease. It can kill people, right? And it's lethal even if you are previously normal without any diseases. You didn't have any diseases before, and you were exposed in the way that you were exposed. Let's remember that there was something like this happening before in Durango, and in those, my understanding is the mortality was over 40%, perhaps 48%, I heard. So that means that this can be devastating.
Right.
But what can make a difference, and I'm not saying this to scare people, right? It's just because information is powerful for you, how you make decisions. You may have been called about this and you thought, I'm feeling perfectly fine. Why should I worry, right? So let me tell you the reason why this information is useful for those who have been exposed, or if you know someone who has been exposed. It is useful because this is not the typical acute meningitis where you get the symptoms right away. There can be a window in which persons are relatively asymptomatic with mild symptoms, and then over time they start developing more severe significant symptoms. Our concern, and when I say our concern, I have to recognize the word, the Fungal Meningitis Work Group. It's a group of volunteer faculty and medical students and residents who have been helping with the response at Valley Baptist Medical Center, right? Our concern is if people are presenting too late, and we have been seeing those patients in our hospital, they are presenting too late, there are already a lot of damage. There is already a lot of damage caused by the fungal infection. What if people present earlier, before those symptoms are significant, or when they are asymptomatic and we can detect the infection early? Perhaps if we find the infection early, we can treat it early. Exactly. And I had to do that differentiation. I'm sorry to cover with that. I know that I hope that's clear. But
because I mean, we're piggybacking off of COVID-19. We sort of learned the importance of like catching signs and symptoms pretty early, because we tend to ignore it whenever we get. I mean, we on a previous podcast that we had, we talked about the importance of not ignoring the signs and symptoms. The moment you see them, get yourself checked, and it's very important. And much like with COVID, I mean, COVID-19, SARS coronavirus, that's been around before. Meningitis has been around before too. But it's like this, it's knowing that it's now lethal is a very important thing. And knowing the difference between like severe symptoms versus casual symptoms, it is important to make that differentiation.
Yeah, so to highlight the concept, yes, symptoms are important. Don't ignore the symptoms. But in this case, it's important, even if you don't have symptoms, recognize that you were exposed. Because if you were exposed, you need to be tested early. And if we can catch that infection early, I think, we don't know because this is a rare disease. We are learning a lot, and we are probably going to be having to write about this in the future, just to make sure everybody knows what happened, right? And we learn from it. But because it's new, there's things that we don't know, but it makes sense to us and from previous exposures in Durango, that people who present early tend to do better.
Exactly.
And that's why the whole department is asking you or your family or your friends who were exposed to go to an emergency department and get tested. Because if you are detected early, perhaps, and you are infected, you're not infected, that's great. Good news. That's even better. But if you are, this gives you a chance to have better results, because people in Durango didn't do great. They had a lot of problems, a lot of complications, and had similar exposures.
Right. It's very important for us to learn from our previous times and do better.
Right.
Sure.
Thank you for that. No, that was a very important question. I really appreciate it.
You mentioned testing. What testing is being done on these patients when they arrive at the hospital?
When you get there, first of all, you need to tell the doctors and whoever talks to you why you're there, right? Let them know that you were exposed and that you are aware of the cases of fungal meningitis. Tell them about when you had your procedure, what kind of procedures you have, if you know. Or tell them you are concerned if you are not clear about the details for some reason, right? Once they have that information and confirm that you were actually exposed, then they will do something called a lumbar puncture. And a lumbar puncture is they put a needle on your back, right, in an area that is thought to be very safe to do that. And they advance slowly the needle until they see fluid coming out, and that fluid is the fluid that connects your brain with all the nerves coming down, right? So that's why they can find information about the brain even they are taking this from the back, right? And that gives information because you can see if there are cells there that suggest that there are inflammation, but they also do some special tests that can be sent out that are kind of taking pieces of the fungi and detecting if they are present in the fluid. So those tests can help doctors understand that maybe even if the fluid looks otherwise okay, you may still have an early infection. So someone will need to follow up and let you know about those test results if they come back positive. So this initial information, this is the main test. I was reviewing this morning the updates from also at the national level, which is recommended to do the lumbar puncture. And there is no, there is a recommendation to also get an image depending on those results. Some facilities like ours are still unsure if we should be doing more testing or not. But national guidance is you should at least get that LP, and depending on those results, you perhaps are going to need what is called an MRI, which is a very high quality picture of your brain. And that is also going to help, because if there are changes there that could be part of an infection, then even if the lumbar puncture abnormalities were not that significant, that may help confirm early on that there are other changes or the potential for complications. If, of course, the conclusion is that you do have meningitis, right, then usually you are going to have to be started on therapy for the fungal infection, right, until we know more, until the doctors know more, which is what we call antifungal drugs. You are usually starting on 2 of those. And then from there, it depends. But unfortunately, some of the things we have been learning, well, it's fortunate that we are learning, it's unfortunate that this is happening, right, is that some people can get bleeding in their heads, right? So why will this happen? I mean, one hypothesis that we have been discussing is that these organisms could probably invade, and we know that this has been reported, right, in the past, that can invade the blood vessels around the brain. So if they weaken those vessels could bleed and then can cause complication. I think for doctors this is important, because if you are treating a patient like this, even if you're giving the right therapy, if the vessels have been weakened already, perhaps these patients may still have a complication later on, right? Even other things may be looking better, but perhaps that patient is having more headaches, or the pattern of the headache is worsening, and it doesn't seem to make more sense when you look at the fluid that they extracted. It may be looking better, but you still can have a vascular, which is a blood vessel complication in your brain, and bleeding in your head, if that helps everybody to understand what we're talking about.
Mm-hmm. Now, can you tell us a little bit more about the treatments and procedures for fungal meningitis?
Sure, definitely. It needs to be a treatment through your veins, right? So you get the antifungal drugs usually through your veins, just to make sure that it's enough and that the concentration are appropriate. So doctors will send out levels of one of the medications and will try to adjust the dose either up or down. Of course, like any medications, they can cause adverse events, side effects, right? So doctors will be monitoring for that. So they will be doing labs, initially even daily labs, for most patients who are in the hospital, and look if there are any kidney problems, if you're having any hallucinations or behavioral changes with some of these medications. Check if there are other medications that could cause interactions, right? But at the same time, they will be monitoring if you're responding to the treatment. And right now, usually that means that you may have repeated sampling of the fluid over time. And also means that because of what I say, right, morbidity, when I say morbidity, is getting very, how we identify the patients as getting very sick or dying. So what we are learning from people who got very sick, or unfortunately some people have died too, is that we need to have a low threshold. That means if we suspect it, we should act. If we see that there are symptoms that may mean that someone may be bleeding in their brain, right?
Right.
And that needs a specialized testing, and that cannot be treated in all healthcare facilities, right? So centers that have that capability to test for problems with your blood vessels or intervene if there is bleeding may be important during that acute portion of the illness. And I have to thank here all the neurointerventional radiologists or neurologists and critical care team who have provided, and also the Fungal Meningitis work group of volunteers who have been helping us identify these patterns and help us update our local Valley Baptist Medical Center and UTRGV School of Medicine guidance. So thank you everybody for that, and we'll continue to do that.
And these locations are the places where people can go for
Valley Baptist is the only center that has these capabilities, but I mean the physicians should know about the different centers across our region who can take care of, do these tests and take care of these patients, including ours. Yeah.
Alrighty. If anyone wants to know more about fungal meningitis symptoms and treatments and what have you, where can people go to learn more?
Yes, definitely. I mean, the health department website has updates and information. I will definitely start by going there, and they have links to other sites that could be helpful, right? To learn about fungal meningitis, and just be aware that because of the novelty of this, and novelty in the sense that this is a rare disease, right? So we don't get to see it a lot. Expect a lot of updates and changes in the way that we understand and see this disease. And it doesn't mean that the initial guidance was not thoughtful. It just means that because it's rare, we get to learn more and more as we see it. So when we learn, we have to use that information to update the guidance that you are receiving. So don't be surprised if you see changes. Those changes are usually due to that continuous engagement to learn more about what's happening and what's best for our community and our patients.
Absolutely. And that just means that we're learning more about these diseases. Therefore, we are now getting better treatments and making sure that people get the right help that they need.
That's right. Thank you for that.
Absolutely.
Just to wrap up, we talked a lot about the different symptoms. We talked a little bit about the situation. We talked about the different therapies that are available and the prognosis of this illness. Any final thoughts or recommendations that you would like to provide to our community, just given everything that's happening, the scope of which, how many residents are being affected?
Right. Well, first of all, this brings an opportunity to highlight the important role of infection control. And that means all the methods and procedures that ensure that the treatments that you're receiving are secure and are safe, right? And unfortunately, sometimes bad things can happen, even if you try your best, but sometimes there may be ways to do things better to keep a patient safe, right? This happened in another country, right? But it's still impacting people in our community. But I think it's the importance of being aware that non-news is good news for infection control. That's one thing. And the other thing is just for all those persons that have been affected, really, I mean, the message is you need to present early. Please go. So if you haven't done this already, please go to the emergency department. Tell them why you are there, right? So that you can be screened early, because the screening is based not necessarily on symptoms like we were talking earlier, but on exposure, right? Anybody exposed should be screened for this, because this disease can be devastating and we think that identifying and treating early can make a big difference.
Absolutely. Dr. Maldonado, it was a pleasure having you. Thank you so much for your time. And thank you to the listeners for joining us on this very informative Health Yes podcast. Don't forget to subscribe and follow us on all of our social media platforms at CCPH Texas and Health Yes on Spotify, so you don't miss out on the next episode. And as always, stay safe, stay healthy, and more importantly, stay informed. We'll see you guys on the next one.